Fever is a common complaint which is usually related to an infection of viral, bacterial, or parasitic origin, and it may be a valuable guide to the diagnosis and severity of infections. Fever is defined as an auxiliary temperature above 37.5 degrees Celsius, right after keeping the thermometer in place for 3 minutes. And fever above 38 degrees Celsius in children and adults often needs urgent attention, especially if the patient is restless or delirious. Not every fever is due to malaria or typhoid, and every fever should be investigated and treated appropriately. A thorough history, physical examination, and appropriate investigation would usually reveal the cause of the fever. In neonates and the elderly, severe infections may not be accompanied by a fever. In infants and young children, fever may be associated with convulsions, collapse, or coma. Causes are viral infection, bacterial infection, fungal infections, parasitic infestations, hematological malignancies, for example, lymphoma and leukemia, and also connective tissue disease. The medicine could be medicine related. The symptoms are chills, rigor, body aches. And the signs that are usually elicited are temperature above 37.5 degrees Celsius, evidence of dehydration, for example, sunken eyes, evidence of underlying conditions, and tachypnea, tachycardia. Investigations, FBC, blood film for malaria parasites, rapid diagnostic tests for malaria, cultures of urine, blood, sputum, ear discharge, throat swab, wound swab, cerebrospinal fluid, depending on presentation. So the main treatment objectives are to reduce body temperature to normal, to relieve symptoms, to identify and treat the underlying cause of the fever. Non-pharmacological treatment. So you keep the patient well hydrated with fluids, for example, water, fruit juice, light porridge, rice water, or coconut milk. You maintain nutrition. You continue breastfeeding in babies. Tepid sponge the child. Wet a towel with lukewarm water and apply to the body, starting from the extremities and gradually work your way towards the head. You leave a film of water on the body to dry on the skin. Repeat the process as often as needed. The pharmacological treatment: you give paracetamol oral in adults 1 gram 6 to 8 hourly, in children 10 to 15 milligrams per kilogram per dose. You may repeat dose 6 to 8 hourly as needed. Or paracetamol rectal suppository in adults 1 gram 6 to 8 hourly, in children 125 to 250 milligrams 6 to 8 hourly. Or ibuprofen oral in adults 200 to 400 milligrams 6 to 8 hourly, in children 7 to 18 years give 200 milligrams 6 to 8 hourly. 2 to 7 years give 100 milligrams 8 hourly. 6 months to 2 years 50 milligrams 8 hourly. 1 to 6 months you give 5 milligrams per kilogram 6 to 8 hourly. You treat the cause of the fever appropriately. Do not give aspirin to children under the age of 16 years. You control convulsions with diazepam. So referral criteria: a fever persisting for more than 10 days in spite of treatment should be considered as pyrexia of unknown origin, as PU, should be referred for further investigation. Let's look at the guidelines for the treatment of patients with fever. The complaints, we look at the diagnosis and the action. So rigors, fever, occasionally periodic, sweating, general malaise, and joint pains. Diagnosis: malaria. Action: you take a blood film or perform rapid diagnostic test for malaria parasites and treat appropriately. For complaints: rigors, fever, sweating, general malaise, altered sensorium. The diagnosis: cerebral malaria. And action, you take a blood film or perform rapid diagnostic test for malaria parasites and treat appropriately. Complaints: headache, vomiting, drowsiness, stiff neck, and also seizures. Diagnosis: meningitis. Do not delay treatment while awaiting results of the lumbar puncture. Complaints: cough, brown sputum, rapid breathing, pain on deep breathing. Diagnosis: pneumonia. You give appropriate antibiotic. For increased frequency of urination or painful micturition and loin pain, diagnosis is urinary tract infection. And the action: you do urine examination plus culture and sensitivity, and you give appropriate antibiotic. For complaints, fever, constipation, or diarrhea, it may be with blood, and also headache, abdominal pain, general malaise. The diagnosis is typhoid. Is that appropriate treatment? And complaints: warm, swollen, painful, reddish looking lymph. Diagnosis: cellulitis or erysipelas or impetigo. Give appropriate antibiotic. Complaints: fever in a child with cough, sore throat, and red eardrums. Diagnosis: otitis media. You give appropriate antibiotic. And if the complaints: fever during pregnancy with loin pain, diagnosis: pyelonephritis. You take sample for urine culture and sensitivity, and you give appropriate antibiotic. If the complaint is pain in a bone, usually a limb bone, which is painful to touch, diagnosis: osteomyelitis. So action: X-ray the affected parts and treat for osteomyelitis. So jaundice preceded by feeling unwell, anorexia, low-grade fever. Diagnosis: viral hepatitis. You do liver function test, hepatitis B surface antigen. You treat conservatively, and also bed rest. For headache, body ache, runny nose, and sneezing, diagnosis: common cold or influenza. And action: you give paracetamol if required. For long-standing fever, weight loss, chronic diarrhea, and lymphadenopathy, diagnosis: acquired immunodeficiency syndrome. Action: you manage as appropriate. If the complaints are sore throat or pain on swallowing, diagnosis: tonsillitis or pharyngitis. You manage as appropriately. We treat the tonsillitis or pharyngitis appropriately. For abrupt fever, chills and malaise, weakness, muscle pain, rash, diarrhea, bleeding, diagnosis: viral hemorrhagic fever, for example, Ebola virus disease. You manage according to standard protocol.